You know, it, it, it's just a heart-stopping moment, isn't it?
Right.
When a pet gets into an accident, maybe hit by a car or a bad fall, something really, traumatic.
Oh, absolutely.
And if they pull through that initial chaos, your first thought is just relief, massive relief.
Hmm.
But what if the danger isn't actually over just because they survived the impact? What if that blunt trauma, that force, could have these hidden sort of delayed effects,
Mm,
especially on the heart?
that's exactly where we're headed.
So that's our deep dive today. We're unpacking this really interesting and maybe a bit counterintuitive condition. It's called traumatic myocarditis in dogs, sometimes cats too.
Right.
And it's linked directly to blunt force injury, but the name might be a little off based on the material we've got.
Yeah, it seems that way. We've basically been given this pile of expert insights, research papers, vet notes. Think of it as our guide through the key docs on this.
Okay. And our mission here for this deep dive is to kind of cut through all that complexity. We want to pull out the really crucial nuggets of info and get you up to speed fast on what this thing actually is, how it happens, and importantly, why it's often delayed and why you absolutely need to be vigilant after any major trauma your pet goes through.
Couldn't have said it better.
So let's start right there then. What is traumatic myocarditis? And you mentioned the names a bit misleading according to these sources.
It is, yeah. The sources, they mostly define it as a syndrome, basically abnormal heart rhythms, arrhythmias that can pop up after some kind of blunt trauma. Now, myocarditis usually means inflammation of the heart muscle.
Right, like an infection or something.
Exactly. But the research we looked at is pretty clear. If you do find lesions on the heart in these cases, it's actually more likely to be necrosis, cell death, not really inflammation in the classic sense.
Oh, wow. Okay, that's a big difference right off the bat.
Mm.
So less about the immune system attacking, more like direct damage killing cells. And does the heart itself even need to take a direct hit? Because I think the sources hinted, maybe not always.
That's one of the really fascinating points, I think. The material suggests you don't necessarily need that direct heart impact on the heart itself. It looks like factors outside the heart, they call them extracardiac factors, probably play a pretty big role, maybe even the main role in causing these arrhythmias after trauma in a lot of cases.
Whoa, hold on. So the injury could be somewhere else entirely, like the chest wall or lungs, and that can trigger heart rhythm issues.
Yeah, seems so.
That completely changes how you think about it. Okay, so the sources say severe arrhythmias aren't, like, super common.
Yeah.
But the ones that matter clinically, they definitely happen.
They absolutely do, and that's the key takeaway the material hammers home. Because these significant rhythm problems can occur, it's basically essential, mandatory even, to carefully check the heart rhythm of every single animal that's had significant blunt trauma. You can't just assume they're fine because they seemed okay right after the accident.
Got it. Total vigilance.
Mm-hmm.
And when we talk about these arrhythmias, what kinds are we usually seeing with this condition based on the readings?
The sources really focus on ventricular arrhythmias, so ones starting in the heart's lower chambers. The main ones mentioned are ventricular tachycardia, VT, and something called accelerated idioventricular rhythms, or AIVRs. Arrhythmias from the upper chambers, supraventricular ones, or like really slow heart rates, those are apparently pretty uncommon here.
AIVR and VT.
Yeah.
The material specifically separates those two, right?
Yeah.
What's the difference? Why does it matter?
Yeah, they draw a clear line. AIVRs are usually slower. The sources often put the rate between, say, 100 and 160 beats per minute in dogs. They're often seen as, well, relatively benign. Sometimes they just kind of appear briefly, maybe only when the heart's normal pacemaker takes a little pause.
Okay. And VT?
VT is faster, usually over 160 beats per minute,
Mm-hmm.
and it's potentially much, much more dangerous. And one point the sources make is that a seemingly harmless AIVR can sometimes, unfortunately, speed up or kind of morph into the more dangerous VT.
Okay, right. That's worrying. Let's get into the mechanics then. This is where it gets really interesting, but maybe a bit technical. How does getting hit by a car, that physical force, actually damage the heart muscle cells in a way that messes up the electrical signals?
Yeah.
What's the pathophysiology they describe?
Right, the how it happens. The sources explain how these common traumas, car accidents, falls, even fights with other animals send major forces through the chest.
What kind of forces, exactly?
They break it down a bit. There's direct compression or concussion, literally the heart getting squeezed or hit. Then there's deceleration injury. Think shearing forces when things stop suddenly.
Ouch.
Yeah. And also compression injury, where these high-pressure waves travel through the tissues from where the impact happened.
And these forces physically damage the heart muscle cells themselves, the myocytes.
Precisely. Leads right to injury. It can range from just swelling edema to actual bruising inside the muscle, which is ecchymosis. You can even get small blood clots forming within the heart muscle tissue, intramyocardial hematomas.
Right.
And then result can be cell death, myocyte degeneration, and necrosis.
Okay, so you've got these damaged or dying cells. Why does that make the heart's electrical system go haywire and cause arrhythmias? What's the link?
That's the key step, the arrhythmogenesis. Basically, injured cells become electrically unstable. The sources explain it's because of changes in how ions, sodium, potassium, calcium, move across the cell membrane. Their resting electrical charge can drop, making them fire off signals too easily.
Like they're irritable.
Exactly. Irritable is a good way to put it. Plus, you get increased calcium inside the cell, which is another factor. Damaged areas can also create these weird electrical short circuits called re-entry circuits, causing rapid, abnormal beats. Or sometimes the injured tissue itself just starts firing off its own electrical signals, acting like a rogue pacemaker.
Wow. So it's like a perfect storm. Physical damage leads to electrical chaos. And we touched on this, but the sources really stress it's not just the direct hit, is it? Other body-wide things contribute.
Yes, absolutely. Those extra cardiac factors are critical. The whole body's reaction to severe trauma plays a massive role. It can worsen arrhythmias or maybe even trigger them.
Like what kind of things are we talking about? What else is going on?
The sources list quite a few. Low oxygen levels, hypoxia. Imbalances in electrolytes, especially potassium and calcium, are highlighted. Acid-base problems, like the blood becoming too acidic, acidosis. The state of shock itself, meaning poor blood flow everywhere.
Right, the body's just struggling.
Exactly. And the huge surge of stress hormones, catecholamines. Plus, of course, any other injuries happening at the same time, like bruised lungs or broken ribs. All these things create an environment where the heart muscle is just much more likely to develop these abnormal rhythms.
Okay, makes sense. So you've got the trauma, the potential damage, these other contributing factors.
Well,
When do you actually see signs of these heart rhythm problems, and what should you look for?
this is probably the most critical clinical point in all the material, the late onset.
Right, you mentioned that earlier.
It's crucial. These arrhythmias almost never show up immediately after the injury. They tend to develop 12 to 72 hours later. The peak time seems to be usually around 24 to 48 hours after the trauma happened.
That timing is just so important to grasp. Checking them right after the accident and saying, okay, isn't enough.
Definitely not. When the animal first comes in, usually the signs you see are from the main trauma itself. You know, pain, shock, breathing trouble from lung damage, maybe. The heart issue is often lurking silently at first.
And the signs specifically of the arrhythmia, what might those be?
Well, they can be pretty subtle, sometimes non-existent, especially with that slower AIVR if it's not really affecting blood flow much. But if signs are there, you might see things like weakness, just general lethargy. Maybe they get tired really easily with minimal exertion. A really worrying sign is syncope fainting. That strongly suggests the arrhythmia is bad enough to cut blood flow to the brain.
Okay, fainting is the big red flag.
Yeah.
Anything else?
Yeah, maybe pale or bluish gums. Maybe their breathing gets worse if they already had lung issues, sometimes vomiting, not wanting to eat. Or you might actually feel an irregular or super fast heartbeat when you check their pulse.
Okay, and just to quickly recap the rhythm types again, we're mostly worried about the ventricular ones, the PVCs.
Yeah, PVCs, premature ventricular contractions. Those early beats from the bottom chambers are common precursors. They can set off AIVR or VT. So yeah, the main focus is ventricular. PVCs, AIVR, which can be okay but needs watching, and VT, which is the potentially dangerous one. Those supraventricular or slow rhythms are much rarer in this context, according to the sources.
So how do vets figure this out? What's the diagnostic approach when they suspect traumatic myocarditis after an injury?
Well, first step is just having a high index of suspicion. Any vet seeing an animal post-blunt trauma needs to have this on their radar. It has to be considered.
Okay, suspicion first, then what?
Immediate stabilization, always. Deal with shock, bleeding, breathing problems first. Then a really thorough physical exam, focusing hard on the chest and circulation.
And the STAR diagnostic tool mentioned in the material, the go-to test.
That's definitely the electrocardiogram, the ECG. And this ties right back to that delayed onset we keep mentioning. An ECG taken right after the trauma might look completely normal. Which is why the sources strongly recommend continuous ECG monitoring. using telemetry or maybe a Holter monitor, ideally for at least the first 48 to 72 hours. That's how you catch these arrhythmias that pop up later and might come and go.
Makes total sense.
Yep.
What about blood tests? Anything specific beyond the usual trauma panel?
Yeah, besides the standard checks like red cell counts and organ function, checking electrolytes is key potassium, calcium, because imbalances mess with heart rhythm. But the sources specifically highlight cardiac troponins, CTNI or CTNT. They're presented as really sensitive and specific markers for myocardial injury. They tell you if heart muscle cells have actually been damaged or are dying.
Okay, so they confirm heart muscle damage, but they don't tell you if arrhythmias will happen or how bad they'll be. Is that right?
Exactly right. The material makes that distinction very clear. Troponins confirm cell damage happened. They give you a number, a quantity of injury, and they can go up within hours. But they don't predict whether arrhythmias will occur or how severe they might be. They signal injury, not necessarily the electrical consequence of that injury.
Got it. Injury marker, not arrhythmia predictor. What about imaging, x-rays, heart ultrasound?
Chest x-rays are pretty standard, yeah.
Yeah.
Mainly to look for other injuries that often go along with this, like pulmonary contusions, bruised lungs. And importantly, those lung bruises might take 6, maybe 12 hours to really show up clearly on an x-ray.
Ah, another delayed finding.
Yep. And echocardiography, the heart ultrasound that's recommended for more severe trauma cases, or if you strongly suspect heart injury. It lets you actually look at the heart structure, how the walls are moving. You might see areas that aren't contracting well or thickening from swelling, maybe even see the bruising or clots inside the muscle. More advanced stuff like CT or MRI isn't really used routinely just for diagnosing traumatic myocarditis in pets, according to these sources.
Okay, so we know what it is, why it happens, the delayed timing, how to find it. How do you actually treat it once it's diagnosed?
The sources are pretty consistent here. Treatment really depends on how severe the arrhythmia is, and importantly, whether it's actually causing clinical signs like weakness or low blood pressure. And a really key point they make is that many of these trauma-induced arrhythmias are transient. They often just go away on their own without needing specific heart meds.
Oh, interesting. So you don't always jump straight to the antiarrhythmic drug.
Not necessarily, no. The foundation of managing these guys is treating the whole patient, the overall trauma. That means things like oxygen if they need it, careful fluid therapy, being cautious not to overload them, and absolutely crucial pain management. The sources strongly back potent opioids and warn against using NSAIDs right away in acute trauma.
Oh, I know NSA.
Potential impact on kidney function and blood pressure in an already unstable patient, mainly.
Gotcha. So supportive care, pain relief. What?
What else? Treating any other injuries they have, obviously. And critically, enforcing strict rest, cage rest, minimal excitement to reduce stress on the heart.
Okay. So when do you decide, right now we need the antiarrhythmic drugs?
Basically, when the arrhythmias are causing obvious problems, if they're leading to low blood pressure, making the animal weak or faint, if they're happening really frequently or are sustained long runs of fast beats, or if it's a rhythm that's clearly life-threatening, that's the trigger.
And the drugs themselves. What did the sources mention?
Lidocaine comes up repeatedly as the first choice, the primary drug for ventricular arrhythmias in these situations. They even provide specific dose ranges for dogs and cats. If lidocaine doesn't work, then alternatives like sotalol or procainamide might be considered. For those really rare cases of severe slow rhythms, atropine might be used, and maybe diltiazem for the super rare, supraventricular ones they mentioned.
And did the sources include any warnings about using these drugs?
Oh yeah, absolutely. This is really important info they stress. Antiarrhythmic drugs are powerful, but they're not harmless. The sources specifically warn they can actually make existing arrhythmias worse or even create new ones that weren't there before. It's called proarrhythmia.
Wow, okay, so it's a careful balancing act.
Exactly. Deciding to use them means carefully weighing the risks against the potential benefits for that specific animal. They also briefly mention DC conversion, the paddles, electrical shock as a kind of last resort for really severe life-threatening VT that just isn't responding to any drugs.
Okay. Looking ahead then, what's the typical outlook, the prognosis for a pet diagnosed with this?
For the arrhythmia itself, the sources suggest the prognosis is generally pretty good. Like we said, most of these trauma-induced arrhythmias tend to be self-limiting. They usually resolve within about 2 to 5 days. And if antiarrhythmic drugs were needed, you can often start tapering them off and stop them within that same time frame, 2 to 5 days.
So the heart rhythm issue itself is usually temporary. That's good news. What about the pet's overall recovery, their long-term outlook?
This is maybe the most crucial point regarding prognosis that the material emphasizes. The overall outcome for the patient depends way more on how bad their other injuries are than non-cardiac ones.
Ah, right, the bigger picture.
Exactly. Things like severe lung damage, major internal bleeding, serious head trauma. Those are much more likely to determine if the animal survives and recovers well than the traumatic myocarditis itself. And while, sudden death from a really catastrophic arrhythmia like VFib is theoretically possible, the sources indicate it's actually rare in these specific trauma cases.
That's reassuring and long-term. Does this usually lead to chronic heart problems?
Generally, no. Most pets that recover from traumatic myocarditis don't seem to develop long-term structural heart issues or chronic heart disease because of this specific event.
Okay, so what does monitoring look like as they get better, maybe get ready to go home?
Well, that continuous ECG monitoring for the first 48, 72 hours in the hospital is still the gold standard recommendation. Plus regular physical exams, maybe repeating some blood work, perhaps even checking troponins again every 12, 24 hours initially to see the trend. Often they'll recommend a Holter monitor for maybe 24 hours before discharge, just to make absolutely sure there aren't any significant sneaky arrhythmias still happening intermittently.
A final check.
Kind of, yeah. Follow-up ECGs later on after they go home are sometimes done, but the sources suggest they're often normal by then. And definitely activity restriction at home for a few weeks is standard advice, usually 2 to 4 weeks, just to let everything heal properly.
Right. Last piece then, thinking about the owner. This must be incredibly stressful. What are the absolute key things a vet needs to communicate to someone whose pet has just been through this kind of trauma?
Yeah, the sources actually cover this specifically, hitting the main client education points. Number one is probably re-emphasizing that delayed onset of the heart rhythm problems. Owners really need to understand why their pet needs to stay for monitoring, even if they seem okay right at that moment.
Explaining the why behind the stay and the cost.
Exactly. And you need to clearly explain that while the heart issue is serious and needs watching, often the overall trauma, the other injuries, are the biggest immediate concern for survival and recovery.
Managing expectations again.
Absolutely. Give them a clear but realistic prognosis. Good for the heart issue itself, usually, but the overall outcome depends on everything else that happened. Be totally upfront about the costs involved, too. Diagnostics like continuous ECG aren't cheap, and potential treatments add up.
And what about when they go home? What should owners watch for?
Clear instructions are vital. Tell them exactly what signs should trigger an immediate call or return visit. Things like sudden, severe weakness, collapsing, extreme lethargy, any worsening breathing trouble. And really reinforce how important that strict rest is during the initial recovery period at home. No running, jumping, rough play. The sources also mention that referral to a specialist like a critical care expert or a cardiologist is often a really good idea in these complex trauma cases.
Okay. Well, we've certainly taken a pretty comprehensive deep dive today, looking at how blunt trauma can have these often hidden, often delayed effects on a pet's heart. We've unpacked the sort of surprising nature of traumatic myocarditis, that delayed timing, and just how critical monitoring and all-around supportive care are after an accident.
Yeah, hopefully exploring the source material like this has given you, the listener, a much clearer picture of this specific complication, why it needs such careful attention in vet med, and just how complex caring for these trauma patients really is.
It really has. And maybe, this whole discussion kind of highlights something bigger too, just how interconnected everything in the body is, how even trauma that seems localized can send these ripples out, forcing us to look way beyond the obvious injury when we're trying to help. It really makes you appreciate the incredible complexity, the resilience, and sometimes, yeah, the quiet vulnerability of these amazing animals we care for, doesn't it?